Hello everyone, this is a chest X-ray which is showing bilateral small nodules which are about 2 to 4 millimeter in size. They are uniformly distributed in both lungs symmetrically in all zones. Trachea is centrally placed. This is right bronchus, this is the left bronchus, and here is left clavicle, right clavicle, and if you can see, this is the medial border of scapula. This is the gastric bubble, and if we can see on this X-ray the cardiac shadows, the left cardiac shadow is quite remarkably identified. However, the right shadow is a bit difficult to identify or mark over its border. Both lungs are having symmetrically arranged nodules in them, small pellet size. And what can be the diagnosis over it? First of all, we have to see the lung volume on the both sides. If there is loss of volume from apex to the base, both lungs are small, and if cardiac borders are not completely identified, then this is the X-ray of interstitial lung disease. And if there are cardiomegaly, and if there is cardiomegaly on this chest X-ray with bilateral infiltrates in all over the parenchyma of both lungs, this can be pulmonary edema. So we have to decide the final diagnosis on the basis of scenario. The differential diagnosis on this X-ray comes first of all the miliary tuberculosis. Miliary tuberculosis has the similar X-ray with small nodules of 2 to 4 millimeter in diameter size, uniformly arranged in the both lung fields, and patient's history is also very important. The differential diagnosis on this X-ray include histoplasmosis, sarcoidosis, pneumoconiosis, bronchoalveolar carcinoma, pulmonary cirrhosis, and hematogenous metastasis from primary cancers of thyroid, kidney, trophoblast, and some of the sarcomas. Primary lung cancer with hematogenous spread may also cause similar miliary shadows. So this is a very important chest X-ray with a wide range of differential diagnosis. There are also other reasons which cause non-cardiogenic pulmonary edema, for example chemical pneumonitis. It can be sarcoidosis even. If a patient is having history of stone cutting or working on marble stones or different marble factories, he can also have similar bilateral infiltrates, and there can also be some calcifications which are incidental findings on the chest X-ray. So summarizing up, this is an X-ray of miliary tuberculosis as patient had history of fever, productive cough, and shortness of breath.